Cancer is one of the major diseases ravaging countries of the world, and the earlier we start its management, the better for all of us. Though health practitioners have been trying round the clock to ensure that cancer is well managed, Nigeria is not left out in this. And on discussion today on Your Image, we want to discuss peer approach to cancer management in Nigeria. I have experts who will be taking cursory look at the cancer management in Nigeria and what are some of the things that we should know, what are the measures we should take, what are precautions that we should take to ensure that cancer is well managed in our country. My guests are here with me. I have Mrs. Omolara Fajobi, a palliative nurse at the Federal Medical Center, Abeokuta. You're welcome to the show.
Thank you very much.
Mrs. Fajobi is also joined by a clinical psychologist at the same hospital, FMC, Abeokuta, Mr. Tommy Ayonshola. You're welcome to Your Image, sir.
Thank you very much. It's a pleasure.
And for the sake of those who are watching us at home, they will want to learn one or two things on this show today. And if I may ask, what is cancer?
Thank you very much. Cancer is a disease entity, and it's caused as a result of mutation of some cells. When some cells get infected, they become abnormal. And when they get abnormal, they proliferate. That is, they come out of their shells, infecting initially their immediate environment. Then they move outside, infecting other parts of the body. Yes. So it's a disease entity.
Okay, you talk about cells.
Yes.
Is it white blood cell or red blood cell that is mostly affected by this?
It's not only the white blood cells that is being affected by cancer. We have both the white blood cells and the red blood cells are being affected. You know, in the body we have white blood cells that eat up cancers in the body that help us, because at every time in our life we are exposed to carcinogenic substance or object or infections, and we have some soldiers in our body which are the white blood cells, the lymphocytes. We have the B and the T lymphocytes. They helps, you know, in eating up this cancer cells so that, you know, it will not affect us. But when it accumulates so much, the body will know this. The white blood cell, it's like you go on a battle. You go to a battlefront and your soldiers are overwhelmed. You understand? They're overpowered. That is exactly how cancer does to our body. When the immune system, the lymphocytes have been arrested, then the cells, those carcinogenic agents, will have power over the body, and we now start having the symptoms.
Now, let me ask, before I go to Mr. Ayonshola, let me ask this one more question from you so that people who want to learn from this show, though it's a publications program, but there's need for us to create awareness on what cancer is all about. What are the major causes of cancer?
Oh, there are so many causes of cancer. The cause of cancer is unknown. I'm sorry. The cause of cancer is unknown, but there are so many predisposing factors. Some of the predisposing factors, we have the genetics. Some people inherit it from their parents.
So inheritance is one of the major things.
Exactly.
Wow.
If a parent has breast cancer, one of the daughters may also inherit cancer of the breast from the mother. Then we have our lifestyle, our diets, obesity. We have race. It's commoner in some race than the other. And we have radiation, exposure to sunlight. You know, because the ozone layer has been eaten up because of human activities. There was a time, you know, we were told that the ozone layer is very exposed because of carbon dioxide in the atmosphere. It eats up the atmosphere, and because of that, we are exposed to direct radiation from the sun, and this is one of the causes, maybe not, causes of skin cancer.
Wow.
Yes.
I still want to ask more on that, because this program is primarily meant for public relations, and we need the salient things we need to learn from this? Maybe by the time we'll do the continuation of the program, I'll ask him. Mr. Ayoshola, you are a clinical psychologist.
Thank you, sir.
Yes, and like she has said, the major causes of cancer may not be known, but she told us some of the likely things that may likely to cause cancer. But if they break the news that one has probably results, is given to one and one is diagnosed of cancer, what comes to one's mind is probably death. Should death be the end of cancer when one is diagnosed of this?
Number one, thank you very much. Number one, it's one of the terminal disease.
Oh, it is a terminal disease.
So it's a thing to be afraid of.
Wow.
However, and that is why there's need for intervention to calm the nerves, because you don't die before you die. You see, when you hear bad news, it's very, very clear that fear will set in, anxiety, you zoom into depression. That's the time you begin to see them not eating as they ought to. They will have problem with sleeping. They will be so anxious, hyperactivity, and so many other things that are very clear. So when we hear bad news, there's no way it will come down. And that is why there's quick intervention. The general public ought to know that treatment of cancer is very important the moment diagnosis is made, and that is when treatment starts. Don't wait until when it enters into severe or chronic level. At the onset of the illness, there are intervention. There's use of chemotherapy, psychological intervention like you're asking me right now is very essential. But one thing that's very common is fear. But you can bury your fear if you are able to maintain your high level of self-esteem. This thing that happened, how can I confront it? Because every problem has a solution. It may be tentative, it may be a palliative way to ensure that the quality of life is well placed in life. So fear sets in.
Now, like you said, one of the solutions, like you said, is communication. Or probably, yes, one of these for communication. And when you're talking about communication, public relations comes into play, because the public relations is one of the tools of communication. Now, the fear sets in, anxiety sets in, and some other things like that. If I may ask you, as a professional psychologist, what are the major symptoms of, I ought to have asked her anyway, but let me ask you, what are the major symptoms of cancer?
Number one, there's pigment problem. I'm talking about skin layer.
Okay.
We see that part of the affected part being affected because already the cells are affected. Because the cells continue to multiply. Maybe sexual reproduction concerning the cells. Everything will be multiplying here and there. Before you know it, the body counts begin to go down. Some, it depends on the area being affected. We have breast cancer, we have colon cancer, we have prostate cancer, which is common among men. But before you know the area to which is affected, there will be this, let me use this word, pigmentation problem. Because the skin have layers. The moment the layers are affected gradually, the cells are being eaten up gradually by these agents, thereby causing problem. Then another thing that normally happens is a wound on that part of the area. You understand? If not well treated at the onset. So those are some of the symptoms. It depends on the area.
All right, you're watching Your Image, and today we're talking about peer approach to cancer management in Nigeria, and we have professionals who will be taking us through some of the major issues that we may likely to encounter in this. And of course, some people are even ignorant of the causes, and even if you have it, he said it's not a death sentence, but proper management should, of course, suffice when it comes. And let me go to Mrs. Fajobi.
Yes, sir.
He mentioned some of the types of cancers that we have. We have breast cancer, colon cancer, and he mentioned one other. Now, can you please, for the sake of our audience, tell us each type of cancer that we have, then what are the
symptoms?
Symptoms, yes, thank you for that. We should look at in each of them, like breast cancer has its own symptoms. It's different from colon cancer. So can you please enlighten us on this?
Thank you very much. We have lung cancer, which is one of the first of it, is the first worldwide. We have the breast cancer. We have colon cancer, rectum and colon cancer. We have the stomach cancer, and we have the prostate cancer, which is third, which is the first in male. So if a woman has a breast cancer, what she experiences first is, if she's the type that examines her breasts regularly, that is, she examines her breasts immediately, maybe 3 to 4 days after her menstrual flow. She stands in front of the mirror, check the size of the breast, is there any changes? You know, she check it clockwise and anti-clockwise to check if there are lumps. Lumps could be tiny and it start growing gradually. You might check it this month and find a lump, and by the time you are checking it next month, you can see that the lump is growing. Definitely something is wrong. Or you check the breast and you see that there are dimples like the back of orange. Yes, it's called the orange. So that can signify that something is wrong with the breast. Or by the time you are pressing the nipple, you find out that, and you are not breastfeeding, you find out that you are lactating, or there is a pus coming out from the nipple, or there is blood coming out from the nipple. It signifies that something is wrong to the nipple. Or there is change in color, like my other professional colleague also said, if there is a change in color of the breast, it could be cancer. Maybe if you are a dark colored person, you can see that it's becoming reddish or is darkened, as if something is burnt. It could be cancer. Or you're a fair person and you can see that it's very red. You need to seek the advice of a medical practitioner. Then in male, we know that they have say of the prostrates. Most of the time they find it difficult to urinate. Or when the urine comes out, it comes out in trickles. They might have pain. They might have back pain. They might have fatigue. You know, they can't carry out their daily activities normally. They have complaints. It could be as a result of CA prostrates. But you don't say somebody has a CA prostrate or has CA lungs. And in CA lungs, you know, they might have inability to breathe very well. Some people might be coughing. You just see them coughing day and night. They couldn't, if they are lying down, they will not be able to lie down properly. They will want to sit up, and yet they are not comfortable. You see the discomfort in them, and you see them, you know, being breathless. It could be CA lungs. And I said earlier, at times you don't diagnose yourself until you get to the hospital and you see the specialists and they make a diagnosis. And also they will go through investigation. It could be blood investigation, it could be X-ray, it could be mammogram, it could be X-ray, it could be scan, it could be an MRI, just to identify what is actually wrong. So by the time the result comes out and they find out that this person has a cancer somewhere, you know, they will tell the patient, or they'll tell the person what to do. They will tell the person, we don't tell patient that you have cancer uprightly.
Wow. So how do you tell? How do you disclose?
Thank you very much. We have good communication skills. You know, it's a gradual process. The patient just don't come and tell the patient that, oh, sorry, you have cancer. You know, you would have told the person, you give the person signals that what if it is a cancer? The person might deny it, especially in Africa. Here, you know, we forbid it. We don't want bad stories. We don't want bad things to happen to us, and we don't want bad news. But there are ways of breaking bad news. It's a gradual process.
There are ways of breaking bad news, especially in Africa. And my next question goes to Mr. Ayoshola. Now let me ask you, as a professional psychologist, how do you break this news? What is the communication strategy that you use to tell patients that they are, of course, diagnosed of cancer? What style of communication do you use?
Okay, communication is very essential, and that's why we are here informing people about cancer. You see, like I told you, it's not so easy to break news unless you are skillful. You don't allow the person to develop sudden death or hypertension by breaking the news. This is what happened. However, in psychological balance, we undergo assessment also to know the kind of person we want to speak with, because personality diversities. There are people who have resilience, who can receive bad news. There are some people who cannot receive bad news. So, different way. We try to identify who are we dealing with, number one. If it's a passionate or emotional personality who can cry at the hearing of that news, there are ways we do it. Like what he said, why can't we consider this? We give alternative. And mind you very well, sir, like what you said, yes, assessment is very essential. Sometimes you say it's cancerous. At the end of the day, when you tested yourself, it's not cancer. So, number one, as an expert, you have to be sure of what kind of diagnosis you are making. Is it cancer? It's a question of just calling people. And that is why caregivers, both former and informal caregivers, are very essential. In breaking of news, informal caregivers who are family members are very essential, because it's become burdensome. Not only we have to share the burden between the patient and the family members. We call the family members, we talk to them, even prior to the time when we are going to talk to the patient, preparing their mind. What we are doing, this is what we have discussed, but we are not sure. It might be cancer. Sometimes we invite clergymen in difficult situations because it's an imam or a pastor. This is what we are facing. And gradually, you begin to open up. We can decide to give the person just to ease up anxiety. Maybe 2 or 3, we can come back in 2 weeks' time. However, lectures will be going. And in our hospital, there's a standard procedure whereby we educate or psychoeducate patients. Whether you're having cancer or you don't answer, we highlight all the symptoms, we highlight the pros and cons of diseases, not even mentioning cancer gradually. From there, we discover that the man or the woman will be coming down gradually. So before you pass the news.
Their approach to cancer management in Nigeria. My guests are here, and I'm sure you are really enjoying their expertise and their level of enlightenment to the people on the need for us to manage cancer, and how do we also manage it when the news is broken to us. What is the communication strategy that we use? What should be the publication strategy that we use as practitioners in the health sector? Mrs. Fajobi, now he has been able to tell us how they communicate to probably victims, so to speak. But now I want you to tell us, what is the age category of people who can have cancer? Does it have maybe, oh, I'm still a small girl, small boy. Does it have any age difference or age category that, that can experience it, so to speak?
Cancer has no age limits.
Wow.
It cuts across. We have children, we have pediatric cancer.
Really?
Exactly. We have pediatric cancer, we have in teenagers, we have in adults, we have in elderly. It can affect anybody, and it can affect any parts of the body. Wow. Even aging is a criterion for someone to have cancer. So it cuts across. Well, if you are following us on this discussion, you can also join the conversation via a phone number that will be displayed on your television screen. You can also join us on DSTV 260, GoTV 100, and StarTime 113. You can also join us on, of course, the website of OGTV, that is www.ogtv.com.ng, and follow the conversation.
It seems we have somebody on the line. All right, now back to Mr. Ayoshola. So much has been said on this. What effort are you health practitioners making in further enlightening members of the public, probably on the danger inherent in cancer or how to manage cancer among them? Because you said it's a terminal disease. So if this happens, what message will you have for the people who are likely to have it, or people who have it, who are expressing it and are watching us at home?
Learning is very essential, and psychoeducation very important.
How do you mean by psychoeducation?
You see, it's just akin to what we are doing now. We are educating people based on what we have at hand. We organize seminars. We organize day by day health talk. Even for people when they come to the hospital, especially in the GOPD. There's a general forum.
What is that GOPD for the sake of those who don't know?
That means
general
outpatient department, whereby you come with people with stroke, they come, people with headache, we come, but generally all ailments. We do a sort of overall analysis using health, and our nurses are very, they are very good in that area. So we start educating people on the issue from there, and that is very important. We call it standard hospital procedure, whereby it's a must that before patient sees the doctor, they have to undergo so many educative sessions. Questions are asked, lifestyle modification, talk about lifestyle. She mentioned one of the risk factor of cancer, because one of the etiological factor is lifestyle. When you don't have good lifestyle, you eat anything anyhow, there are all these agents, you are prone to being affected by all these agents. So you have to tell them. Then the issue of stress too. We educate people on stress.
Wow.
The higher
could that be a cause?
No, it's not. It will really, you are exposed to it. It's hasting the growth, negative behavior of those agents, negative agents. When you are stressed, you can't sleep, you can't eat properly here and there. So those are very essential. We educate them how to manage stress. We continue.
Before we round off on this week's edition, Mrs. Fajobi, what was a message to people as a professional in clinical nursing? So what is your advice for our viewers who are watching us?
My advice for our viewers out there is, one, that we should live a healthy life, eat good food, not just junks. Then we should try to plant vegetables at our backyards. And something that has been bothering me for quite a while now is the way we drop our dustbins out on the roads. Is not too right. There are containers, I mean there are bins where we can drop our dustbins. Because if we should look at the present and the future effects of what we are doing now, we can see that we are destroying a generation. Because at times when you check what they are, I don't know, somebody saw me one day on a Sunday, that one of the OGTV crew saw me. It was this afternoon, someone was telling me that, Mrs. Fajobi, did you remember one day when you were capturing somebody picking some things at the dustbin, yes, on the road? I said yes, that the OGTV saw you and they captured you along with that person. I said, wow, I never knew that. It bothers me so much because we don't know what we are creating for ourselves. Because infection is one of the causes of cancer.
Infection is one of, we will continue from there next week because we will go contemporary. So that means we are continuing with this topic next week by the grace of God. I thank you so much, Mrs. Molara Fajobi, palliative nurse at FMC Doctor. Thank you so much.
You are welcome.
I'm sure you join us next week for the continuation of this program.
I will surely do.
Thank you very much. I'm Mr. Tony Ayoshola, a clinical psychologist from FMC, also in Doctor. Thank you so much. I'm sure we'll be here together next week. By the grace of God. All right, until we meet next week for the continuation of this topic, please let us take good, proper care of ourselves. And for cancer patients, management is also very key and germane to a healthy life. So please, let's take care of ourselves. Until we meet next week by the grace of God, let's live a healthy life.
you.